Eczema is a condition marked by itchy and inflamed patches of the skin. It is often diagnosed in babies and young children, but can also appear in teens and adults. No information on what exactly causes eczema, but researchers believe it is a combination of genes and triggers. For example, eczema can be caused by a defective gene that does not produce enough filigrin. Filigrin is responsible for maintaining a healthy barrier for our skin. Without enough filigrin, bacteria and viruses can enter the skin. Some triggers include dry skin, metals, cigarette smoke, fragrances, certain fabrics, PPD, formaldehyde, and stress. Eczema is generally diagnosed by looking at a person's symptoms and by examining the skin. The doctor might also try to test out a patch of skin to rule out other infections. The doctor will then continue to ask a lot of questions about hygiene, when the symptoms appeared and whether the rash is persistent or comes and goes, and many more. The doctor might also try a skin biopsy, which is removing a small piece of skin for lab testing. Eczema does not currently have a cure, so the treatment is aimed at treating the damaged skin and preventing symptoms. Treatments are suggested based on age, and sometimes eczema can go away over time. There are some at-home treatments like using humidifiers or taking warm baths, and even medical care treatments like antibiotics and antifungal medications. But even with that, eczema can be a lifelong disease. There are many symptoms of eczema, for example, dry skin, itching, red to brown grayish patches, small raised bumps, thickened cracked, scaly skin, and sensitive, swollen skin. And they all affect the epidermis, which is the corneal layer. 31.6 million people are affected by eczema in the U.S., which is equal to 10% of the U.S. population, while 700 million people are affected by eczema in the world, which is equal to 10% of the world's population. There are no cures for eczema, but many treatments are available. For skin care at home, there is bathing in warm water because hot water can dry out the skin, wearing cotton material because wool and synthetic material can be irritating to the skin. Also, fragrance-free laundry soap is suggested. And also, applying moisturizers daily because fragrance-free moisturizers can prevent irritation to the skin. Also, try using a thicker cream or ointment at night. Medication-wise, there is corticosteroid creams, solutions, gels, balms, and ointments. They can quickly relieve itching and reduce inflammation. OTC hydrocortisone is often the first thing doctors recommend when treating mild eczema. You may need a different strength of those steroids depending on where and how bad your rash is. Some methods that can assist in lowering the risk of an eczema outbreak are establishing a consistent skin routine to keep your skin healthy and moisturized, using a soap that isn't too harsh when showering, and patting your skin dry instead of rubbing it, which may cause unnecessary irritation and dryness. Always applying a moisturizer after taking a shower, drinking water when presented with the opportunity to keep your skin moist. Try to wear clothing that is made of natural materials such as cotton to avoid unwanted irritation, making sure that your skin is properly protected according to the temperature of your environment, and avoiding scratching or further contribution to the irritation of your skin. These methods are not guaranteed to completely prevent eczema, but they lower the chances of sudden outbreaks.